Welcome to Lecto. Today we are going to discuss the detailed anatomy of the humerus. Before we start, we first of all revise the basic plane of the body. Here you can see this is the superior and inferior, upper and lower portion, posterior and anterior, backward area and in front area, medial and lateral, medial towards the core of the body and lateral away from the core of the body. So here you can see the two structures of the humerus, and this is the right humerus and this is the anterior view of the humerus. This is anterior view and this is the posterior view. Posterior view. So here you can see this portion, this region is actually the medial region and this is the lateral region. This is towards the center of the body and this portion is away from the center of the body. Here you can see this is the lateral region and this is the medial region. Same here, towards the center of the body, away from the center of the body. So first of all, we divide the humerus into three parts. First one is the upper portion. Second one is the middle portion, which is also called the shaft. And last one is the lower portion. So first of all, we will discuss the upper part of the humerus. The most important component in the upper part is the head of the humerus. This head will articulate with the glenoid cavity of the scapula. There is a glenoid cavity in which the head of the humerus will articulate or accommodate. So this is the scapula, and the scapula has a cavity which is called glenoid cavity. And the most important is the two tubercles, greater tubercle and lesser tubercle. And between these tubercles there is a depression which is called the intertubercular sulcus or bicipital groove. Here you can see towards the medial side, this is a lesser tubercle. And at the lateral side, this is the greater tubercle. So these are basically the two tubercles which are actually the projection. And between these two tubercles, there is a depression which is called intertubercular sulcus, or you can say bicipital groove, which is present between the two tubercles. And here you can see the head is separated from the lower part of the humerus by an alignment which is called this alignment. This is actually called the anatomical neck. This neck separates the head of the humerus from the rest of the humerus. So this is the anterior view. If we look at the posterior view or posterior side, so here you can see at the posterior side you will see the head. Same here at the anterior side. And there is another neck which is present at the posterior side, and this neck is called the surgical neck. Why do we call it surgical neck? Because most of the fractures of the bone occur at the surgical neck. And below the surgical neck, approximately 0.5 millimeter below, there is an other neck which is called the morphological neck. Morphological neck. So this neck is basically the epiphyseal line. So this is the morphological line. Three neck present: anatomical neck, surgical neck, and morphological neck. So these are the components which are present in the upper part of the humerus. Next is the shaft, which is the middle part of the humerus. So we divide the shaft into three borders and three surfaces. We will discuss shaft according to the magical boxes. Magical boxes. So here you can see two boxes, and we divide. This is the anterior view. This is the anterior view of the box, and this is the posterior view of the box. We divide the anterior view into three borders. First border is the lateral border. This is the lateral border. Middle is the anterior border, and next is the medial border. So these are three borders. Same here, at the posterior view, there is a lateral border and medial border. So this is for anterior. This box is for the posterior. You will see this side is at the lateral side there is a lateral border. At the center there is a anterior border, and at the medial side there is a medial border. Same here at the posterior view. At the lateral side there is a lateral border, and at the medial side there is a medial portion. So the surface which is present between the anterior and the lateral border is called the anterolateral surface. So this surface is actually the anterolateral surface, which is present between these two borders, anterior border and lateral border. And the surface which is present between the anterior border and the medial border is actually called the anterolateral surface. So these are the two surfaces, and the last is the, if we see at the posterior side, there is another surface which is called the posterior surface. So this is the posterior surface. So we discussed three borders: lateral border, anterior border, and medial border, and three surfaces: anterolateral surface, anteromedial surface, and posterior surface. So now we will discuss each borders and surfaces one by one. First of all, we will discuss the lateral border. We will further divide the lateral border into three components. We divide the lateral border into three components: upper portion, middle portion, and the lower portion. So these are the basically three portions of the lateral border. Here you can see at the upper portion of the shaft, this actually lie in at the upper portion there is a portion of the greater tubercle. Greater tubercle will lie in the upper portion. At the medial portion, here you can see medial portion. This is the medial portion, and in that portion deltoid tuberosity is actually present in the medial portion. And at the lower portion, at the lower side, here at the lower side there is a ridge. which is called the lateral supracondylar ridge. Supracondylar ridge. So this is present at the lateral side. So upper portion contain the a portion of the greater tubercle, middle is the deltoid tuberosity, and lower is the lateral supracondylar ridge. And next, anterior border is further divided into three portions: upper, middle, and lower. So in the anterior border, this is actually the anterior border. So in anterior border, there is a lip of greater tubercle. Tubercle is present. So upper portion contain lip of greater tubercle. Lips are basically the projections of the greater tubercle. And if we move forward and at the middle portion, so here you can see at the middle portion there is a margin of the deltoid tuberosity. Margins of deltoid tuberosity. Deltoid tuberosity is present. And at the lower there is no as such component present, and this is the smooth area. So upper portion contain lip of the greater tubercle, middle portion contain the margins of the deltoid tuberosity, and the lower portion contain no component, and this is the smooth area. And the medial portion also divided into the three portion: upper, middle, and lower. So at the medial portion there is a lip of lesser tubercle. Lip of lesser tubercle present at the upper portion. And if we move forward, then at the middle side there is no as such component present at the medial border, which is actually the smooth. Medial border is actually the smooth. But at the inferior side or the lower portion, here you can see at the lower portion there is another ridge which is called the medial supracondylar ridge. So this is present at the lower portion. Upper portion lip of lesser tubercle, middle smooth, and lower is the medial supracondylar ridge. So these are basically the three borders. And if we talk about the surfaces, so anterolateral surface, which is present between these two borders. So the most important component which is present in the anterolateral surface, which is present between the anterior border and the lateral border, is the deltoid tuberosity. The important component is the deltoid tuberosity, which is present in the anterolateral surface. This is actually the anteromedial surface. At the anteromedial surface, the important component present, two basic components are present. First one is the foramen of nutrients, and second one is the intertubercular sulcus, which is present between these two components. So anteromedial surface contain two components: foramen of nutrients, and second one is the intertubercular sulcus. These two components are present in the anteromedial surface. Foramen is actually a hole through which the blood vessel enter into the bone and provides nutrients to the bone components. So these are the two components present in the anterior medial surface. But at the posterior surface, if we look at the posterior side, so important component will be, first one is the oblique ridge. So this is the small projection which is present at the posterior side. And second most important component which is present at the middle side is the spiral, or you can say radial groove. So this is present at the posterior side. These two components are important in the posterior surface. So this is the shaft region, and the last is the lower portion. So here you can see there are two important components present in the lower portion. So important components include, first one is the articular portion, and second one is the non-articular portion. So articular portion includes which attach to the other bones, and non-articular portion that does not attach to the other bone. So first of all, the important components is the trochlea and the capitulum. These are the two important components. Trochlea will attach to the ulna and the capitulum will attach to the radius. So these are the articular portion or area. This is at the anterior side, and we will see only trochlea at the posterior side. Trochlea. So above the trochlea, which is actually trolley-like structure, above the trochlea there is a depression which is called the, this depression is called the coronoid fossa. Above the trochlea there is a fossa which is called coronoid, and above the, here you can see above the capitulum there is an other fossa which is called the radial fossa. Radial fossa. So keep remember, at the lateral side which bone is present? Radial bone is present. But at the medial side which bone is present? Ulna is present. So, and there are two fossa, coronoid fossa and radial fossa at the anterior side. But if we look at the posterior side, there is another third fossa which is called the olecranon fossa. Olecranon fossa. So these fossa are important in its role. Coronoid fossa will accommodate the coronoid process of the ulna when the hand is in flex state. So when hand is flexed, the coronoid process will accommodate in coronoid fossa. Like this is the coronoid fossa, and the coronoid process of the ulna will accommodate in this fossa. Same here, radial fossa, and the radial will accommodate in the radial fossa when the hand is in flex state. But if we talk about the olecranon fossa, these fossa will accommodate the ulna in what situation? In extend situation. And last is the epicondyle. There are two projections of the bone at the lateral and medial side. At the medial side, here you can see, at the medial side there is a depression or there is a projection of the bone which is called the medial epicondyle, and at the lateral side there is a lateral epicondyle. Keep remember, medial epicondyle relatively lower as compared to the lateral epicondyle. So these are the two epicondyles. Same here, this is the lateral epicondyle and this is the medial epicondyle. So these are basically the two condyles, and above the ridge there are two ridges. Above the medial epicondyle there is a medial supracondylar ridge, and above the lateral epicondyle there is a lateral supracondylar ridge. So these are the basic structure or the components of the humerus. If you have any question, then you may ask in the comment section. Thank you.